Thanks for listening today. Today I got Ryne Bessmer here with us from Strada Healthcare. Going to be asking him a few questions about direct primary care. You know, the advantages, disadvantages, some things like that. So we're happy to have him here today. So Ryne, if you don't mind telling us, just tell us a little bit about Strada Healthcare, a little bit about yourself.
Sure. Yeah. Thanks, Phil, for having me here today. We're big fans of Ellerbrock-Norris and appreciate the opportunity to talk about direct primary care and what we do. I've been around with Strada since our very beginning. My father is a primary care physician and really has a passion for how can we make healthcare more affordable, how can we make it easier to access, and how can we make it more sustainable for primary care. And I hope today we can talk a bit about from the doctor approach. But he's been thinking for years about how do we solve primary care, because in today's world, from a consumer perspective, we're used to these long waiting times when we go to visit our doctors. And from a doctor perspective, they're used to having to see so many patients per day that it's just not sustainable. And so we got to thinking back in 2016 when we started Strada Healthcare, what could a model look like that gave doctors more time with patients and that made healthcare more transparent for patients and for individuals. And we got to thinking, if we removed insurance from primary care and didn't require doctors to spend any time doing paperwork, prior authorizations, filing claims, could we potentially solve this? And instead of requiring patients to pay per visit or anything like that, we just charge a flat monthly fee. And so this concept of direct primary care in 2016 was growing on the West Coast in Seattle. And so we kind of looked at what they were doing and said, we're going to try this in Omaha. And so to put it, really simply, it's a primary care clinic. You pay $99 a month for an adult. And for that $99 a month, all your primary care is covered. You can visit the doctor as often as you need to. All your acute visits, follow-up visits, preventative labs are covered under that fee. Our goal is that the majority of your care is covered under that fee. We recognize that insurance is very important. Everyone should have some type of catastrophic backstop, but it works really well for people because they're able to know that I can go visit my doctor and I don't have to worry about being nickel and dimed. And the doctor, on the other hand, knows I can spend as much time as I need to with this patient. I don't have to ask them certain questions that insurance companies require me to ask them. I don't have to see a certain number of patients every day in order to get paid more money. Instead, I can really focus on relationships. So direct primary care is focused on relationship care and really putting the focus back on how can we save money for individuals and make primary care something that more medical students want to practice in their career.
Mm-hmm. Absolutely, and I can tell obviously that you're very passionate about direct primary care. Can you talk about some of if you could name 2 or 3 advantages? What would those advantages be when it comes to direct primary care, and why someone would want to engage in it?
Right. If you're someone that is looking for convenient healthcare, direct primary care would be a great option for you because at least in Strada, we promise same to next day appointments and as much time with your doctor as you need. And so if you're someone that values the convenience and being able to get in quick, and also we offer telemedicine, and this isn't just any telemedicine app that gets you a doctor somewhere. This is connected with your provider. And I can't, personally, I have been in situations where I've been out of town. I have a health question, and it's really convenient and trusting for me to know that I'm texting someone that I know, have a relationship with. And you don't get that in the regular healthcare system. And maybe outside of 2020 with the pandemic and telemedicine becoming more prevalent. But for the most part, in order for a doctor to get paid in a typical insurance environment, they had to bring you in. And that's why, even if it's simple as I always, me personally, I get allergies every year. I know I get allergies every year, and I know I need a prescription for it. And in a typical world, I would have to go sit in a waiting room for 45 minutes to be seen by a physician to fill a prescription that he fills for me every year. And in direct primary care, I can just text him and say, hey, doc, can you please fill this for me again? And it's done. It saves me time. The other group that may find direct primary care valuable are those that are looking at how can you save money. Again, all chronic disease management can be managed under direct primary care. And if there's many people out there that are seeing specialists right now for conditions that could be managed by a primary care doctor. It's just in today's system, those primary care doctors can't spend as much time with them to maybe manage that, and so they end up with a specialist. And so for people that maybe have many specialists that they're seeing that would explore, could I potentially have more of this care or all of this care handled under direct primary care? there's cost savings there. And not to mention avoiding a trip to an emergency room. I can't tell you how many times in our ecosystem of Strada we have someone text in and say, I cut my arm, do I need stitches? And it's a Friday night. And the doc either says, yeah, you do, and I'll run in and I can help you out with that, or no, you don't, strip it up and we can handle this on Monday. And so helping people to avoid unnecessary emergency room trips is a really great way to save money. And honestly, the way we're able to do it is because people trust their doctor enough to reach out to them and ask them questions and things like that. So I would say if you value convenience, if you value potentially cost savings, and frankly, supporting your local doctor, paying your doctor directly. Direct primary care is a great way to support your local doctor in your neighborhood, in your city.
Absolutely. And I couldn't agree more with those things that you just mentioned. Well, that wraps it up for this first episode. I appreciate everyone tuning in. Stay tuned for more episodes to come where we're going to dive into some different topics around direct primary care.
Thanks, Phil.